Aloha, I'm Brickwood Galuteria. Welcome to Kupuna Power, a show for and about seniors. As always, we display the Senior Helpline phone number, 768-7700. Today, we discuss long-term care and more specifically, how we pay for it. We also see how Medicaid, Medicare, the Affordable Care Act, and other government programs address the high cost of assisted living. Navigating through the rules, regulations, and forms can be frustrating and time-consuming. A mistake may prove costly. Oftentimes, a kupuna, already alone and beset with physical and mental challenges, needs help. The burden then falls on the family and caregivers. Who do they call? Help is available from the private sector, a concierge service, if you will, for health care. The option is a topic of our discussion. To talk about options for long-term care regarding our kupuna is Scott Gardiner. His company will help you navigate through the paperwork of Medicaid and other programs. Welcome to the show.
Hey, good morning.
Thank you for helping empower our kupuna. Now you're a navigator.
Yes.
And in many cases, if we use that canoe analogy, which we like to do, because we're all in the same canoe together, you're going to help us get to that island of quality care for our kupuna. So what does your company do? We'll get it. We're not here to promote your company. We're here to promote getting them to the island.
Sure.
So why don't you start there?
Okay. Scott Gardiner Company, what we do there is we do Medicaid financial consulting. And what that simply means is we help navigate folks who need Medicaid. We help them through the application process from beginning to end. And as a navigator, we like to set a efficient and direct course. And that brings a lot of worries, helps the families understand the process to get Medicaid.
Because you're also helping the families.
Correct.
I think what we fail to recognize is a kako thing.
Yes.
And every family's a canoe too.
Correct.
Right? So you encourage family members to get involved in kupuna planning too?
Yes, correct. What we've noticed is that the children are the caregivers, and they get to that breaking point, and we call it a caregiver burnout. So eventually they'll hit the wall, sometimes sooner than later, and they need to look at getting their loved one or their kupuna parent placed in some type of nursing care facility.
So we're getting a little older, say 65. Well, when do you become eligible for the services, like Medicaid?
Medicaid. Medicaid will pay for long-term care. So if the aging person declines in health and needs much more heavy-duty assistance, then that's when we would look at applying for Medicaid. Most folks, older folks, will have Medicare and maybe a secondary insurance like HMSA or Kaiser. Now, Medicare and HMSA, for example, together is very, very good insurance, but it's good for, we call it full coverage for hospital setting and physical therapy setting. If the person needs to transition to a nursing facility, then those insurances won't cover. They won't cover that. So if a person goes into a nursing home or foster home, let's say, then they would either pay privately by using their savings, and after they deplete their savings to a certain point, then they can jump onto Medicaid.
Okay, so let's go to the origins of Medicaid then.
Okay.
How did that start? And it serves everybody. It's there, and you can trip the switch or trigger it when you want to or when you need to.
Correct.
Correct.
Correct. So Medicaid is governed by the state, and it's for the indigent. So indigent is a fancy word for you have to be
you cannot afford.
Yeah, low income, low assets, or eventually broke. Yeah.
I see. I see. And then Medicare.
Medicare, traditionally you get it at age 65, and when you work, you pay taxes into the system, and when you turn age 65, that's going to be your primary insurance. And Medicare comes in three parts. Part A, which covers hospital visits. Part B covers doctor visits, and then Part D for drug. So that becomes a primary insurance, but it doesn't pay in full. You still have large out-of-pocket co-payments. And if you can afford a secondary insurance, then the secondary insurance will help pick up those co-pays. So,
do you folks have a standard need that comes with growing old. You know, the kupuna, they're going to come to you, they're going to say, okay, Scott, help me. I need it. What is the first questions that you ask? What are the first things you look for in order to come up with a good option, a good plan?
Yeah. You know, that's kind of a tricky question because, you know, we used to attend these senior fairs, and there's a lot of myths that go on with Medicaid. And people would just bypass us and say, oh, I'm not eligible. I own a home, for example. I don't qualify. But Medicaid says you can own a home and you can still qualify for Medicaid. So there's options, and I wish people would stop and come and talk to us.
Yeah, really. Yeah. That's what we want to do here at Kupuna Power. We want to know our options, you know. And if one of our options is to contact friends like you to help us get there, you know, I think that's what we want to encourage people to do. Is there something that you would recommend to the Kupuna right now as they say, almost like, I'm going to use myself as an example, okay? I like to call myself a junior senior. Okay. We've said that many times here on this show. Okay. What should I be doing right now at age 58, 59?
Right now, you should maybe look at talking to a estate planning attorney.
What should I have done, because I haven't done it yet?
Well, one thing is round up take a look at all your investments and your assets and your income, your property, and then go talk to an estate planning attorney, or come, you know, talk to myself. I'm not an attorney, but if you're planning kind of in that direction for long-term care, you know, we can give you some pointers on what to do, and we can connect you with the right type of attorney that can handle your situation.
So if I haven't done anything up till now, it's kind of late.
No, never too late. Never too late. Yeah,
okay. Yeah. It's just, it'll be a little bit more expensive.
Could be. Yeah.
Really?
Yeah.
Okay.
Yeah. Folks, when they come to us, they're at the point of need where their health has already declined. They're in the hospital or in the nursing home, and now they need Medicaid. But then when we start talking with them and then sharing with them that, you know, there were some other options that you could have done beforehand, and then that's when they kind of kick themselves like, wow, I wish I could have come seen you earlier.
You know, it's important that we understand there's folks like you in our community that can help us get to where we got to get to. Who do you talk to mostly? You talk to the Kupuna themselves, or you talk to their family members?
Yeah, normally at this point in time, their parent already had a medical episode, so they're in a facility, or their health is declined to such a point. And so we're normally talking with the children. And, you know, sometimes the children could be Kupuna themselves too. So, but it's mostly the caregivers.
That's true.
Yeah.
I never thought, the children can be Kupuna as well. So you'd be working with them too for their programming.
Correct.
Their planning.
Yeah.
What is, in this particular day and age, what seems to be the biggest problem that Kupuna face that you have to deal with? Besides just getting old. Okay.
Well, when it comes to Medicaid, Medicaid is a real tricky process because nursing home cost is a high ticket item. And when they're applying for Medicaid, Medicaid requires a lot of documents. You have to prove to Medicaid that you qualify. And they look at a various amount of things from citizenship to income to assets to property and trust. And if you've had assets before, how did you spend it down? Did you give anything away? And you know, the application is 50 pages long.
Really?
So one little mistake could jeopardize your application just out of not knowing.
Will Medicare help me stay at home? Or will Medicare basically get me into a facility that I need? Because I'd like to stay home as long as possible, I think.
Correct, yeah. Those insurances do not necessarily pay for home health. If you want to stay at home, it is private pay, and meaning cash. And private pay is more expensive than going into a facility because it's the one-on-one type of care.
No kidding. Okay. So hypothetically then, perhaps I should start thinking that one day I may need to go into an assisted living facility and I can get help from Medicaid, Medicare, or of course a combination.
Correct. Or even long-term care insurance.
Long-term care insurance.
Yeah. Long-term care insurance, everyone's policy is a little bit different. So if you have a policy, you need to look at it. You need to see how much it pays per day. For example, in the nursing home nowadays, it's already $300 a day or $355 a day. And so your policy may only say it pays $150 a day.
Then you got to subsidize that on your own.
Correct. So
beyond that,
Your insurance, the long-term care insurance could pay, and then you're going to be pinching from the savings. But what we've been finding out is that medicine is better nowadays, and people are living longer, outliving their money. So they could eventually dry up their long-term care policy, their savings, and then eventually go on to Medicaid.
And services like yours can put my plan together. At least help me
Correct. Yeah.
navigate.
Correct. Yeah. At least understand the whole picture, because Medicaid looks at all those components, and
Sure.
and you got to iron out all those items before seeing Medicaid.
Oh, yeah.
Yeah.
Okay. Well, you helped me a little bit here.
Okay.
You helped me know what I don't know, which is a lot these days as we prepare for our golden years, right?
Yeah.
And thank you very much for serving our community in that way. And, although we're not here to promote your company in particular, we're thankful that you do a service for our kupuna that not too many people do. So thank you very much. Mahalo.
Thank you,
Mahalo to
Herman.
Scott.
Thank you.
Let me emphasize that there's a charge for his services, but with a brief phone assessment, Scott and his staff will determine whether his services are right for you. Mahalo nui loa to Scott Gardiner, and we'll be back after this.
Thank you.
Up next, we take a look at Kupuna programs sponsored by the Department of Parks and Recreation. But first, what Oahu City's name translates to water of the mullet fish?
I'm the recreation specialist, actually a senior specialist. My job is to coordinate and arrange for, this center, Makua Senior Center itself, also the island-wide programs we do. What we offer is programs in each of our parks to meet the needs of our local seniors. Then those things can be things like exercise programs, dance programs, cultural awareness programs. Anything they want to come, they come to the park, and we try to get them in a nice, safe environment. Each of our major rec centers around the island, we have over 42 clubs, all the way stretching from throughout downtown out to Wahiawa. If you want to head all over to Kahuku, we have something going on over there. So all these clubs are there to keep you in your community, because we found out when the seniors go to their communities, they're more open to meet people they haven't seen for years. The socialization benefit is huge. We have seniors who retire and suddenly they begin a second life, whether they're golfers, whether they want to be painters, whether they want to just take up ceramics, something they've never done before. So we create this opportunity to get them out of their house. A lot of them will retire to become babysitters. And we say you enjoy your grandchild more if you guys have activities going on with your grandchild. So we push for those types of programs. We have the Baby and Me programs. We have Grandma and Child programs. All these things going on in the parks. We're at the Makua Senior Center. What we offer here is classrooms for education, such as English as second languages. We also do paintings. We do calligraphy work. We have groups get together to teach photography to each other. We offer a ceramics program, and the ceramic programs are great. Jeff Chang, one of the great island potters, comes in, helps us out. We offer an oil painting class here. Oil painters get in and they do portraits. As well as that, our main auditorium holds recreational programming such as dancing, aerobics, and cultural awareness courses as well. We look at the community to see what is the needs of the community. A lot of times the recreation director who is in your local park will ask community leaders or ask your senior groups out there, what do you guys want? The city and county funds for your advisors to be on site. For the specific classes, depending on what you're doing, there may be fees. The fees would normally be $2 per session along those type of lines. But we here at Makua Center pride ourselves on trying to get instructors to come and volunteer. So a lot of our programs are free. And most of your programs that you get at the recreation centers will be free. All of our rec centers, they offer classes. They also offer clubs, our senior social clubs for you to go to. With the classes, you sign up for a specific class, just like you're at a university. You go in for your class session. When it's done, you go home. A lot of seniors sign up for classes throughout the day. They'll bring their lunch and they'll make a day of it. The other thing that the centers offer, or rather the recreation centers offer, is our senior clubs, in which they get together once a week for their social aspects. If you go to your local rec center and ask them about it, they'll probably have the club or one is in the nearby center. With the senior club programs, we have about 4,000 seniors registered in the clubs. The water aerobics programs are growing. We have some heated pools on the island at Makiki. Kaneohe has their pool. Kailua has their pool. And the water programs are great because it takes the weight off the body and the seniors get in the water. What we've noticed a lot is the change from just getting together for a social group to a lot of the seniors wanting to go for specific activities, specific things they can learn, such as they want to now learn painting. Those programs are opening up. They want to learn ceramics. Those programs will be opened up. One of the bigger trends we've noticed is on exercise. Zumba classes have grown tremendously. There's Zumba Gold, specifically made for seniors. One of the things we're noticing is a lot of seniors are now wanting computer knowledge. So we are looking into computers to get people more onto computers. And it'll be more so the basic, just to get them introduced to using a computer. How to go online, look for your friends on Facebook. You know, and I know a lot of seniors really enjoy doing that. The model that we'd be looking at, we're bringing them in for a social aspect as well. They'd be able to get out of their homes, come to the center, sit down with a group of people they may have never or may have lost track of, and then they can sit down and start learning to use the computer in a fun environment. It won't be stressful to say, why haven't you done your homework? It'll be more of, okay, everybody, let's go look at this recipe for how to make this type of short ribs. But of course, you have your dance programs, hula, ukulele, things like that. The seniors love it. They've constantly come back for it. You know, it's always a treasure to come to work because every day you walk in, it's like, you know, Christmas again. You open a new package. What am I going to learn today? We've had stories coming out from persons who survived World War II, persons who had interesting lives telling us stories about what they've done. These two gentlemen were now sitting down side by side in a class doing little woodworking skills. One of them served for the Japanese Army during World War II, and the other was in the 100th Battalion in Japan as a translator. So these two men may have been looking across a battlefield at each other. And it's funny because they start looking at each other and they start to talk. And you start to hear the stories from them come out, and you just think that's a whole different generation. And we like to encourage the men to come out, to let them know we don't only do crochet. If you want, we can do a car club. If you want, we can do a fishing club. All these things can be done. That would be a big wish I'd have, is to get more of the senior men out into our group. Second one would be to encourage the children of our seniors to get their parents to join clubs and let them show their independence more. A lot of times we have a lot of the children trying to raise their parents, telling them, don't eat that, do this, don't do this. Instead of realizing your parents lived a full life. A lot of them are capable. Let them explore the next segment of their life instead of restricting them down. The third one I guess I'd like to see is more intergenerational mixing, where we can get the seniors with maybe some of our teenagers, so that these teenagers can see that grandma is a whole lot more than just grandma. You know, she lived a whole life. There's a lot you can learn from her. One of the biggest things that came out with the males were the Makua Ali softball program. We had a bunch of men who were retiring. They played ball in the past, and they want to stay active. So we got them to form their own slow pitch league. The rules are adjusted, and now we have over 50 plus teams on Oahu. Every month, those clubs get together, and they have what we call our council meetings, where they share what their clubs did over the past month. We then compile all this data, and we make it available to the rest of the island. So they share ideas through our council meetings, but we also share ideas because we have advisors in each club, and we communicate directly with the advisor. Yeah, we want the people in the community to realize the rec center is there for you. Come on out to the rec center, meet the staff, talk to our staff, let them know what you'd like. And once we find out what your needs is, we can then start to make the programs happen. Come on in, meet your rec director, go to your park. Everyone seems to think the parks are only for the kids. They're not. They're for everyone, all ages. Our directors, yes, they can teach you to play basketball. They can run your volleyball leagues. They can do all of those things. But they can also teach you arts and crafts. They can teach you painting. They have exercise programs. They have aerobic programs. So if you wanted to just join teams and things, that's there. But we've noticed most of our seniors like to come for social aspects. Just like to encourage everyone to join our parks. The parks are there for you. Go out. It's not just a piece of grass. There's also a building, and when the building gets together, it's a whole lot of people.
What Oahu City's name translates to water of the mullet fish? The answer is Waianae, named for a valley on the leeward coast. Wai means fresh water, and anae, the full-sized mullet. Up next, Kupuna Power introduces you to Eric Dishman, a global leader in using technology to improve the lives of patients and caregivers. But first, in 1875, the Hawaiian nation was thrilled to learn of the birth of Princess Miriam Likelike and Archibald Scott Cleghorn's daughter. Who was she?
What I'm trying to drive, and what many countries are trying to drive, is to move from this kind of mainframe model of healthcare where, if you think about computer mainframes, we used to send people there and they had to travel long distances to use computers. Now we all have access to them and they're personal technologies. We got to do the same thing for healthcare. We simply can't afford to wait until people are sick, send them to a mainframe medical hospital, put them back together again. We're going to use disruptive technologies like the smartphones we all have, the tablets we all have, the software capabilities and data sitting in the cloud to allow virtual visits, to allow you to take your own vital signs and share those, and to allow you to connect with other patients, not just doctors and nurses. That's the key to cost savings for healthcare in the future. We always knew there would be this transition for technologies where medical diagnostic technologies go into the home would first be individual medical devices, right? And you see this. We're seeing ultrasound become a dedicated device that can go to the home. A defibrillator, right? People put home defibrillators on their Christmas shopping list. That was a medical technology in hospitals, and now it's a piece of consumer electronics. But as smartphones take off and as wearables are just now starting to take off, these are going to be general purpose tools that we're buying for just computing in general, but they're going to be increasingly capable of doing medical diagnostics or checking out how our body's doing. In Asia, we're already seeing smartphones that have diabetic monitoring glucose equipment just built right into the cell phone, right? That trend is starting. So we'll move from lots of small medical devices that have gone mobile and become cheap to just integrated in the consumer electronics that we're all using regularly. Everybody said we would never use cameras in the phone. Now they say we won't do healthcare in the phone, but we will, and we are going to. I'm really hopeful that aging in place technologies are going to just prevent lots of accidents and illnesses that don't even need to happen. A good example is falls. I mean, in the United States, we spend billions of dollars each year of healthcare costs on falls. It's the beginning of the end for a lot of older people. That fall happens, they break their hip, they get infections and pneumonia while trying to recover from it. They never get their mobility back, and it's just this cascade of painful to the family and expensive to the institution kind of problems. Simple sensors put into smartphones, simple sensors that we can wear, we believe could prevent 75 to 80% of those falls from ever happening. I mean, that's low-hanging fruit with technology that we can do now. Then there's future things like genomics and all of that, but my God, start with what you can do with $3 sensors that are going to save billions of dollars on healthcare bills. There's a big strategic question and a big unknown question about whether it's going to be traditional hospitals and clinics and kind of big medicine who are going to use all these technologies to disrupt their own business model and do things differently, drive healthcare to the home, empower patients and family members to use technology to care for themselves, or whether someone else is going to come in and do it for them. We're increasingly finding in places that have passed payment reform, things like Obamacare, which starts us down that path, in the European Union and Australia and in China. We're increasingly seeing the big hospitals sort of say, yeah, you know what? We're going to have smaller footprint hospitals, and we're going to use cloud-based technologies and services and sensors and the consumer electronics that are all around us to deliver care in a really different way. I don't know who will ultimately win. It could be the corner drugstore that uses its position so near to all of us to deliver virtual care services to all of us, as well as the physical stuff we need, the drugs and the equipment. I don't know who will win, but I do know the disruption is happening, and everybody sort of knows they need to go figure this out, because personal health is going to be very different than the last 200 years of what we've offered. We need to reach escape velocity from the gravity of the way that we've been doing things for 200 years. And I think the disruption is actually already here that's going to force us to do that. We will do it when forced to, otherwise human change and changing society is just, we won't do it. And the disruption here is demographics. I mean, you can't double and then double again the number of older people in a 50-year period and say business as usual will work. We already know that healthcare is bankrupting counties, states, and sometimes even nations. And this is before most of the age wave has really hit. It's just on the cusp of that silver tsunami, as they refer to it. That's the disruption. The question is which countries are going to get there first, which states are going to get there first to solve their own healthcare problems, but also open up new industries and technology and jobs for themselves. This is a jobs creator and a new technology creator as much as it is, just let's fix the healthcare system. I am a social scientist at Intel. I've got a team of medical anthropologists and social scientists, and we study providers and family members and patients around the world. And there does seem to be a little bit of a generational difference where, I mean, certainly the new med students coming in are incredibly facile with social networking, and some of them can even program their own phones to build little apps. So you've got a new generation of doctors and nurses that are like, gosh, I need some reminders to do this for the patient, and they just pop on their phone and program it. I thought there would be more resistance from older doctors to some of the telehealth technologies and capabilities, but what some of them tell us is, we used to have the time to spend quality time with the patients and understand what their social network issues were and what their economic issues were and what their family dynamics were. And in this sort of factory line of 15-minute frisking that they're forced to do in the modern healthcare system, they can't do that anymore. So helping them understand that the new technology is in some ways helping them go home again, right? Do home visits, but do them virtually. It's a pretty empowering thing for them, and they don't want to have to make decisions about older people or patients without the real knowledge about how this is going to fit into their lives. Yeah, there's new opportunities for care workers to be in healthcare without ever walking into a bricks and mortar clinic and hospital, and we've got to figure out those data jockeys and those data analysts and new kinds of clinical training and tools for those folks to be able to, I'm the best person in the world at actually understanding mammography, or I'm the best person in the world at actually looking at, genomic data and helping sort of figure out what's really going on there. I mean, you're right that Intel's approach to the world is we're the, computing power and sort of core technologies that enable a lot of these healthcare technology breakthroughs, but we don't deliver them ourselves. We partner with the Dells and the HPs of the world, the GEs of the world, to help them take general purpose computing that we keep making more powerful, smaller, and able to sort of do more things with because it's so inexpensive. And they'll be the one who build the end products and scale these things out. But it's much like with the PC industry, right? The future of the medical device industry and the future of the aging in place technology industry, we want to make sure it's built on open platforms. There's tons of people innovating at the hardware and the software level. That gets the cost down, the innovation up, the quality up, and that's what's going to make the stuff widely available to the Kupuna who can't afford it, to the family members who are trying to deal with their daily jobs and actually care for their older people. Bring volume economics that Intel did to create the PC industry to the future of the healthcare technology industry. People are asking me, do I actually really believe that Hawaii could make a dent in, the sort of this big global market? People are asking me why I came to Hawaii this week and why I was willing to spend my crazy busy schedule to come out here. And it wasn't just because of the Maui vacation that I'll take starting tomorrow. Smaller states have an advantage here because the big states are so big that they can't get out of their own way to really drive innovation. They can't even get all the stakeholders in one room because they don't even know who they all are. In Hawaii, you can get the payers, you can get the government, you can get citizens representatives from every age group that you need, you can get the not-for-profits, and you can get the academics together in one room in one day. And they can start to argue and lay out a plan that says, hey, we want to be at the forefront of a new industry like aging in place technologies. It hasn't scaled yet. It's not big yet. It's not owned by any other state or any country yet. So I think the way for Hawaii to think about this is, can we be a big fish in what's a small pond right now, but thanks to demographics, it's going to become a tidal wave, and we'll ride it all the way to new jobs and new industries right here in Hawaii.
In 1875, the Hawaiian nation was thrilled to learn of the birth of Princess Mary Likelike and Archibald Scott Cleghorn's daughter. Who was she? Princess Kaiulani. There you have it. Long-term care is a challenge best addressed when we are mentally and physically able to do so. But when we need help for our caregivers, there are resources available in the private sector. I'm Brickwood Galuteria. Join me next week for another episode of Kupuna Power. Aloha.